First of all, I have to say I am so privileged to be here. Um, I'm really thankful that people are going to be listening to me for this. I don't understand. I cannot promise this will be worth your time, but I hope so. Uh, my name is Nora. My pronouns are she, they. I prefer they if that's possible. Um, and yeah, and I will take a couple of just one slide actually to introduce myself because I think that helps you understand where I come from and how I've come to be here. So first of all, I'm not Australian, as you might tell from my weird accent. I'm Italian. I'm a millennial, so I'm no longer very young. I pretend to be very young, but there's quite a bit of research now showing how millennials are shaped as a generation from the multiple crises that they've seen through their lifetime. So that I think has shaped who I am. I'm a physician, I'm an educator, and I'm a researcher, as Jennifer very kindly introduced me. I teach in the joint medical program, particularly looking after years 1 and 2 of medicine. I also teach in years 3, 4, and 5 because why not? I do research on learning environments and learning strategies. My goal is to understand how we can better shape the learning environment to produce the students, to produce the doctors that we want to have when in 50 years we'll face some new health challenge. I'm a gamer, mostly a board gamer, but I dabble in some online games and technological games. And I didn't add that, but I'm also a maker. I'm a big user of the Rainbow Makerspace. I'm a crafter. I was a surgeon, so I feel like I always find most joy when I do something with my hands. I'm here because I designed the board game. And I'm here because I'm making it available as an OER. And many people helped, last but not least, the amazing Ruth Cameron, who's helping me putting this to the rest of the world. There is a list of people at the end of the presentation. You'll see there's many people who helped. Now, why a board game? Human knowledge is increasing at incredible speed. Now we are creating more knowledge than our mind will ever be able to absorb. And I don't need to tell you this. Most of you are involved in the library, so you know. Knowledge is getting increasingly available. That does not necessarily mean accessible, but everyone now has in their pocket something that can access Wikipedia, which is one of the greatest achievements of human society, I believe, right? So we can tap something into our handheld devices and find more knowledge than the generation before us was ever able to access. This means that our role as educators is changing. We are no longer there to make knowledge available because that comes as a default. We are there to provide learners with competencies. Last but not least, competence to navigate this amount of knowledge. In medical education, which is the field that I am in, we aim to give generalist competencies and then prepare students to pursue further training, specialist training, and to continue learning for the rest of their lives. We don't know what's going to happen in 50 years. If history has given us some ideas, it's going to be something horrible. So we need people who are going to be resilient and able to be prepared. I know, you guys, I have a therapist, don't worry. So one of the key competencies of physicians is to be able to collect, analyze, interpret information, and respond to it on a one-on-one level with each patient they see, but also on a global level when they interface with public health systems, healthcare systems more broadly, and research. So board games are now becoming more popular in health education. I've brought 2 board games that I purchased from an extensive collection of serious games. There is a collective that's, you know, a random group of silly academics that call themselves the Gamer Collective, and Gamer is an acronym that stands for Games as Medical Education Resources. And we're producing games. This game has been created by the French Society for Microbiology, and it's about bacteria. This game is about antibiotics. It's been created by Michael Cosimini and Scott Crabtree, and they funded it through Kickstarter, which is a big platform for board games. I decided to do something different, and I focused not on microbiology because I know nothing about that, but on clinical reasoning. So how future healthcare professionals learn to receive, collect, analyze, interpret information, and respond to it. Clinical reasoning typically has been taught in one of these three ways or a combination thereof. We have bedside teaching, which is time intense because it requires people to go on the wards, and clinicians to take time away from their practice to teach. It's also sometimes unfair to the patients because they're there to be treated, not to be teaching cases. There are definitely standardization challenges because we aim not to have patients in hospital for as long as it takes for all of our students to go through. We have small group teaching, which is resource intense again. It's not clinicians, but it's educators that need to teach small groups. And there are, again, standardization challenges. And then finally, there's simulation software. This is really becoming more and more common, but it's definitely costly. There is also limited flexibility to adapt to curricula, even though we can make it more standardized. If I want to change something into a simulation software, I cannot. I don't have the skills. This is an example of what we have, and I have it loaded on this iPad if you guys want to work with it. We have a wonderful software. I love it. It's a virtual patient simulator. We have a 3-year license with 1,000 logins and 60 cases for the entire college. Does anyone want to guess how much it cost? Somewhere in between. Definitely more. $393,914. And I know that because I'm the one who manages this platform for the college. And it's great. And I love it. The students love it. They get to have fun, play around with iPads. Of course, this does not include the cost of the 50 iPads that we need to have, nor the time that I have to spend updating all of these iPads, doing all of the back end. And it's really wonderful, but it's very frustrating. The license is coming to an end next year. We don't know whether we will have funding to renew it. So all of the work that I've done to set up this platform might go out the window. What I did is design a board game. It kind of works in the same way as the fancy virtual patient simulator. There are some differences. I'm happy to expand on that if you wish. But the players move between different rooms on the board, gathering information on the patient that they have. Information can be obtained as you would in a normal clinical setting. So clinical history, physical examination, imaging, and pathology. The aim is to diagnose and hand over the case, which is the same aim as what the Body Interact platform does. And I have to say, I did not design this after seeing the platform. I started designing this before I knew the platform existed. But this is because that's the bread and butter of doctors. We're giving them a simulation software. I won't bore you too much with the specifics, but I have the prototype bootleg copy. And I'm happy to show you every little bit of detail of this game. The cost for a perpetual license, because this has been registered with the university, and Ruth is helping me move further with that. Currently, we have 7 cases that we've developed. Do you want to guess the cost of this? Including the fancy boxes, not my bootleg copy. $1,500, including 5 fancy copies that will be spread throughout the JMP footprint. This also includes the tokens. I had some fancy 3D printed stuff and then I ran out of time to paint them, so we bought some Care Bear Ushis because they work, they're the right size. You could use pebbles, but I bought the Ushis because they are the healthcare bears now. What happens next? We're going to make this game available worldwide. Thanks to the amazing work of Ruth and also Anthony O'Brien, the artist's rights will be protected, as will the IP of the original creators, particularly myself and all of the students who contributed. Content will be available to edit. Cases will be added by us and others, and you'll need just a word processor to do that. This allows for contextualization. One of the gripes I have with Body Interact is that all of the guidelines embedded in the platform are the US guidelines. So if I want to teach my students something different, I can't. With this, I definitely can. And someone in France can edit it so that it meets their requirements. Once it's available, bootleg copies can be printed on any printer for less than $10. Fancy copies are about $200. We tested this game qualitatively and it works. Students appreciate it. We are now working for quantitative effect size, and we will see whether it is effective in teaching measurably and how it compares to other simulation software or teaching software. So why are we doing it open access? I don't need to tell you too much, but I like ranting, so I will rant. Health systems on a global scale are only as strong as our weakest link. And healthcare workforce is migrating. We know that in Australia, currently we have a shortage of healthcare professionals, which means we are importing healthcare professionals. If I, as a patient, cannot trust my healthcare professional to be educated at the standard that I need as a patient, the system gets weaker. I am not treated at the level that I deserve as a patient. So we need to improve medical education worldwide. I come from a country where higher education is free, where if you have a high income in your family, the most you pay for university is 2,000 euros a year. Everyone graduates debt free. Textbooks cost a lot of money, of course, but we see that this is more available. I cannot fathom how some universities in Australia, but especially overseas, charge hundreds of thousands of dollars to educate healthcare professionals. We need healthcare professionals. Why are we paying for them? Why are we making them pay so much? I believe that it's very important to, of course, love the shiny technological advancements, but what needs to work is the core educational principles and foundational theories, so we can create high quality, low tech resources such as this one. And myself and the people in the Gamer Collective, we believe that we can have a community minded approach. These games, particularly this one, is sold at the cost that is needed for printing. So the creators make available their knowledge. There is no print and play version, but they say, you give us the money it costs to print and ship it to you, and we'll ship it to you. I don't know if I have any time left, but I want to spend a second to thank all of the students who contributed to the case writing, and also the artist, Katrina Young, who has given us rights to use her work for a very, very cheap sum, because she also agreed. She's a disabled healthcare, she's a disabled patient, and she believes, as we do, that healthcare should be of high quality. So that's a picture of the game in action. Thank you. If you guys want to reach out, please do so. I am based in the Central Coast, but I'm very responsive to emails. And if you guys want to see this game or these other games or the fancy online platform, I have all of these here. Thank you.